All right, let's dive in. Today, we're digging into something you've probably come across: blue light therapy. Maybe you've seen it in skincare ads or, heard about it in the wellness world.
Yeah, absolutely. And this deep dive feels particularly relevant because it actually came from you, our listener. Someone shared a really comprehensive guide from redlighttherapy.rehab.
That's right. So first off, a huge thank you to redlighttherapy.rehab for putting together such detailed info and really sparking this whole conversation for us.
Definitely appreciate that resource.
So our mission today is to, well, go through this guide together, pull out the key bits of knowledge on what blue light therapy is, how it's supposed to work, what the evidence really says, and what it all means for you.
Exactly. Let's cut through some of the noise and get to the specifics. That guide gives us a great starting point.
Okay, first things first. What is blue light therapy, fundamentally? We're talking about specific colors of light.
Precisely. It's using specific blue wavelengths of visible light, usually from LEDs, somewhere in the 415 to 495 nanometer range for therapeutic effects.
All right. And let's get this out of the way immediately. This is not the same as UV light, correct?
Huge difference, yeah. Absolutely not UV. So no tanning, no sunburn risk, none of that DNA damage concern you get with too much sun. Think of it more like a concentrated dose of the blue light that's naturally in daylight.
Gotcha. That's crucial. So if it's visible light, how deep does it actually get into the skin? I know red light goes deeper, but blue is different.
Yeah, blue light sits at that shorter wavelength, higher energy end of the visible spectrum, but that energy gets absorbed really quickly right near the surface. The guide says it basically only penetrates the epidermis, the very top layer, just a few tenths of a millimeter deep.
Wow. Okay, so its effects are super localized right there on the surface.
That's the idea. Which makes sense for why you see it used a lot for surface skin issues. Dermatology is a big area, especially for things like acne. You know, those LED masks or little handheld wands often feature blue light.
Yeah, I've definitely seen devices mixing colors too, like blue and red light together. Is that common?
Very common. Lots of devices combine blue with red, sometimes other colors too, because they can offer complementary benefits. They target different things at different depths in the skin.
Okay, so the basic concept is shine specific blue light from LEDs onto the skin, non-invasively, hoping for skin benefits, or maybe even other effects. How does this shallow light actually do anything, though? What's the mechanism?
Well, it mainly works through photochemical effects, right, in those upper skin layers. The key is that certain molecules, both in microbes living on our skin and even in our own skin cells, are sensitive to light. They react when specific wavelengths hit them.
Like little light-activated switches inside the cells.
Sort of, yeah. A really good example, and probably the best understood one, is how it works against Cutibacterium acnes. That's the bacteria often involved in acne. These bacteria naturally produce compounds called porphyrins.
Porphyrins, okay.
Yeah.
And blue light does what to them?
Blue light, especially around that 415 nanometer wavelength, really excites these porphyrins. And when they get excited, they trigger a burst of reactive oxygen species ROS right inside the bacterial cell.
Reactive oxygen species.
Yeah.
You mean like free radicals?
Exactly, yeah, free radicals. And this sudden burst is essentially toxic to the bacteria. The guide puts it nicely. It kind of makes the acne germs self-destruct using a chemical they produce themselves.
Whoa, making the bacteria basically self-destruct. That's pretty neat. Is that the only thing it does for acne?
No, there seems to be a second thing going on, too. Blue light also appears to have an anti-inflammatory effect directly on our skin cells. It can help calm down the production of those inflammatory signals, the cytokines, that cause the redness and swelling in pimples. So it helps soothe things after hitting the bacteria.
Okay, so it tackles the bacteria and helps calm the inflammation. Makes sense for acne. But the guide also mentioned things like circadian rhythm. How does light on the skin affect our internal clock?
Good question. That's where the mechanism shifts. The circadian rhythm effect isn't really about the light hitting your skin for therapy. It's about light entering your eyes.
Oh, right.
We have these specialized cells in our retinas called melanopsin cells. They're super sensitive to blue light wavelengths, and they send signals directly to the part of the brain that controls our body clock.
Like how bright morning sunlight helps wake us up and set our clock for the day.
Exactly that principle. Exposing your eyes to blue light, particularly in the morning, is a strong signal to your brain to be alert, can boost mood and energy, and helps keep your sleep-wake cycle on track. The source emphasizes that short-wavelength blue light is the most powerful color for influencing these rhythms.
So, just to be clear, the circadian benefits we hear about come from eye exposure, not the typical skin therapy sessions.
Primarily, yes, for those well-established effects on alertness and sleep timing. The guide does briefly mention some emerging research, looking into whether blue light on the skin might affect deeper inflammation or even pain, maybe through nitric oxide pathways. But that's still pretty preliminary stuff compared to the skin surface effects and the eye-mediated ones.
Got it. So main actions: killing surface bacteria photochemically, calming skin inflammation, and separately influencing our body clock and mood through the eyes.
Okay, so now let's talk evidence. What does the science actually support? The guide breaks down a few key areas.
And I'm guessing acne treatment is top of the list, right? That seems to be where it's most known.
Absolutely. That's the headline use case, the one with the most solid evidence behind it.
So how well does it really work for acne?
Well, like you said, it hits the C. acnes bacteria using those porphyrins and the ROS burst. That reduces the bacterial load. Plus, it seems to help with the redness and swelling because of its anti-inflammatory effects.
Is there good data on that, like clinical studies?
Yeah, the source mentions some. One clinical study, for example, found that around 77% of patients saw an improvement in their acne after about 5 weeks of regular blue light sessions. That's a pretty decent response rate.
77%.
Oh,
That does sound pretty good. But I bet there are caveats. The guide mentioned limitations, didn't it?
it did, and it's important. Realistic expectations are key here. Blue light therapy alone rarely clears acne completely, like 100%. It tends to work best for mild to moderate inflammatory acne, the red swollen pimples.
Not necessarily severe cystic acne or just blackheads.
Likely less effective for those extremes on its own. And it takes commitment. You usually need multiple sessions a week, often 2 or more for at least a month, sometimes longer, to see real results. It's often best viewed as part of a larger plan, maybe with cleansers, topicals, that kind of thing.
So consistency is crucial, and maybe combining it with other stuff.
Exactly. But the upsides are significant. It's painless, it's generally very safe, and it's a drug-free option. That's a big deal for people who want to avoid medications or maybe can't use them or just need something for maintenance. You can get treatments in a clinic or use devices at home.
Okay, so a useful tool, especially for that mild to moderate inflammatory acne, cuts down bacteria and calms things down. But you got to stick with it and know what to expect. What about wound healing? I think the guide touched on that too.
It did. This is definitely a newer, more experimental area for blue light, especially compared to red light, which has more research behind it for wounds. But there's some early promise, particularly for surface wound care.
How might it help a wound heal? What's the thinking there?
A couple of potential mechanisms. It might trigger the release of nitric oxide, or NO, which can improve blood flow and potentially encourage new tissue growth angiogenesis. And then there's its known antimicrobial effect. It could help fight off bacteria like staph or Pseudomonas that commonly infect wounds and slow down healing.
Has anyone actually studied this in people?
There are some early studies, small case series, looking at things like chronic ulcers. Some showed faster closure rates. The guide mentioned one review citing a trial where blue light led to about a 51% greater reduction in wound area compared to the control group.
Wow, 51%. That sounds quite substantial. But I feel a but coming.
You got it. The huge caveat stressed in the guide is that the evidence here is still pretty limited and often low quality. It's described as promising but not proven. We definitely need more, bigger, better clinical trials.
Okay.
And there's another nuance. The benefits seem linked to low doses. There's some suggestion that high doses of blue light might actually slow down healing.
Right, so definitely not something to just try DIY at home on a cut.
Oh, absolutely not. This isn't standard practice at all. You should not be using blue light on wounds without explicit medical guidance. It's strictly in the research phase for the most part.
Understood.
Yeah.
Okay, moving on. Mood and circadian rhythm support. This loops back to the eye exposure.
Exactly. Blue light is incredibly effective at regulating our internal body clock. It's the most potent part of the light spectrum for stimulating those special melanopsin cells in the eyes that talk to our brain's clock.
Like the light in those SAD lamps for seasonal affective disorder.
Precisely. Those standard bright light therapy boxes owe a lot of their punch to the blue light component. Getting that exposure, especially in the morning, ramps up alertness, boosts energy, and helps sync up our sleep-wake cycle.
Did the guide have any specific findings on this?
Yeah, it mentioned one interesting study showing that even low-intensity narrowband blue light around 468 millimeter was just as effective as the standard high-intensity white light, 10,000 lux, you get from typical SAD lamps for improving seasonal depression symptoms.
That's interesting. Maybe less harsh than staring into a super bright white light.
Potentially, yeah. Might offer similar mood benefits with a less intense exposure, but here's where timing is absolutely crucial again, isn't it? The standard advice is always avoid blue light before bed. Timing is everything for these effects. Blue light exposure at night is really disruptive to sleep. The guide highlighted research showing it suppresses melatonin production for twice as long and shifts your internal clock twice as much compared to green light of the same intensity.
Yikes. Okay, so for mood or energy benefits, morning or daytime use only, period.
Correct. Early in the day is best. Avoid therapeutic blue light devices, especially near your eyes, late in the evening or close to bedtime. And, it's important context. This can be supportive, but for serious mood disorders like clinical depression, you absolutely need professional medical help. Blue light can be a tool for alertness or seasonal dips, but it's not a replacement for proper treatment.
Makes sense. Now, beyond the big ones like acne, wounds, and mood, does blue light have other, maybe more general antibacterial tricks up its sleeve, or
Yeah.
uses for just general skin clarity?
It seems so. Its ability to target microbes isn't limited to just the acne bacteria. Blue light, especially in that 405 to 470 millimeter range, shows pretty broad spectrum antimicrobial potential. And importantly, does this without chemicals. It's much gentler on our own human cells than something like UV light, but still pretty tough on many microbes.
What kind of other bacteria can it affect?
Lab studies and some clinical ones have shown effects against a range of bugs, both gram-positive and gram-negative. That includes some nasty ones like Staph aureus, even the resistant MRSA strains Pseudomonas, and even Helicobacter pylori. The mechanism is often similar to the acne story, exciting internal molecules in the bacteria like porphyrins, leading to that toxic ROS burst.
So could this potentially help reduce our reliance on antibiotics in some situations?
That's a really exciting area of research right now. People are exploring its potential for things like disinfecting wounds, maybe treating localized skin infections, sometimes called photodynamic disinfection, maybe where you apply a light sensitizing agent first, and yeah, potentially helping to reduce the need for antibiotics or make existing ones work better. Given the global issue of antibiotic resistance, that's a pretty significant potential application.
Definitely. What about other skin benefits, like just general texture or other conditions?
There's some evidence suggesting it might help reduce oiliness by affecting sebum glands and maybe pore size. And there's also some preliminary work looking at inflammatory conditions like psoriasis or eczema. The source actually mentioned that the FDA has cleared a wearable blue light device specifically for treating mild psoriasis. Right, the trials for that device apparently showed daily use could improve redness and scaling.
Hmm.
Side effects were minimal, maybe some temporary tanning around the area, but it didn't completely clear it for most people. It suggests blue light might have an anti-inflammatory effect on the immune cells involved in psoriasis.
Okay, so summing up the benefits. Strong case for acne, some promising but less proven potential for wound healing, mood circadian timing via eyes, and broader antibacterial uses, plus maybe some help for oiliness or mild psoriasis. Still lots to learn outside of acne, it sounds like. All right, let's switch over to safety. That's always a big question. Is blue light therapy safe?
Generally, yeah, the consensus is it's low risk when you use it properly. The really big plus is NO UV radiation. That means no risk of DNA damage, no link to skin cancer, and no obvious signs of premature skin aging seen in short-term studies. It's painless too, and you don't get issues like antibiotic resistance or the systemic side effects you can get with pills.
Okay, low risk sounds good, but what are the main things people do need to be careful about?
The number one concern, hands down, is eye safety. Our retinas are sensitive to blue light. There's a theoretical concern, maybe with chronic high-intensity exposure, about a potential increased risk for things like macular degeneration down the line.
So eye protection is absolutely critical.
Essential, non-negotiable. Never, ever stare directly into the light source. Always use the protective goggles that come with the device, or at the very least, keep your eyes fully closed if you're using something like a face mask. And be just as careful around babies or pets. Keep the light away from their eyes.
Makes sense. What about effects on the skin itself? Any common side effects?
You can get some mild temporary stuff, things like a bit of redness, maybe some dryness or slight peeling right after treatment, kind of like a very, very mild sunburn. Usually goes away within a day or two. Using a moisturizer can help. Also, people with specific photosensitivity conditions like lupus should definitely avoid it unless their doctor specifically gives the okay. And there's the pigmentation issue we touched on earlier. This is particularly relevant for people with darker skin tones or maybe a history of melasma. The guide pointed out that even moderate doses, it mentioned a figure like 20 joules per square centimeter, which measures the energy delivered, caused temporary darkening in some people that lasted for weeks. So if you're prone to hyperpigmentation, definitely use it cautiously.
Right, that temporary darkening is something to be aware of. And wearing sunscreen daily is probably a good idea anyway, since sunlight has blue light too.
Good point, yeah. Sunscreen helps protect against ambient blue light exposure too. And then, of course, there's the timing issue we keep coming back to. Using it late at night is bad news for sleep.
Right, the circadian disruption.
Exactly. That late night blue light exposure messes with melatonin and your body clock. So, for any potential benefits and just general health, stick to using it early in the day, or at least give yourself several hours before bedtime.
Are there typical recommendations for how long or how often you should use these devices?
Yeah, generally sessions are pretty short, often in the 10 to 20-minute range, maybe a few times a week. The guide really emphasizes that more isn't necessarily better. Going overboard with dose or duration might actually cause unwanted oxidative stress in the skin cells. Best bet is always to follow the specific instructions for your device or what your dermatologist advises.
And when should someone definitely stop and check in with a doctor?
If you notice any unusual reaction, like really excessive redness that doesn't fade, new dark spots popping up where you treated, persistent irritation, or obviously any changes in your vision, stop using it right away and get it checked out. But overall, if you follow the guidelines, protect your eyes, watch the timing, stick to recommended durations, the safety profile is generally considered quite good, especially when you compare it to potential side effects of some medications.
Okay, so let's talk practicalities. Using this stuff at home. There are tons of devices out there now,
Sure.
right? Masks, wands.
Oh yeah, the market has exploded. It offers a lot of convenience for sure. Generally, these home use devices are going to be lower power than the machines a dermatologist would use in their office.
Makes sense for safety. What are the main types you see?
Probably the most popular right now are those LED face masks.
Oh.
They cover the whole face. Then you have smaller handheld wands or spot treatment tools for targeting specific areas. And there are also larger flat panels you can use on bigger parts of the body.
We talked about blue versus multiple colors earlier. For home use, what's the general thinking on blue only versus, say, blue plus red?
For something like acne, many home devices wisely combine blue and red LEDs, and there's good reason for that. They really are complementary. Blue goes after the surface bacteria and calms that initial inflammation. Red penetrates deeper to tackle inflammation further down, soothe the skin, and maybe help with the healing process afterwards. In fact, clinical studies generally show that using combined blue and red light works better for clearing acne lesions than using blue light by itself. So a device with both might give you a more rounded approach for acne. Some devices throw in green light too, but the evidence for green is generally considered less robust than for blue and red.
Okay, so if someone's shopping for a home device, what should they really look for to make sure they're getting something decent?
Good question. Definitely look for reputable brands. Critically, check for clear wavelength specifications. It should explicitly state the nanometer range for the blue light, ideally centered around 415 millimeters, or at least clearly within that effective 400s range. Vague terms like just blue light are a bit of a red flag.
What about things like FDA clearance?
Yeah, looking for FDA-cleared devices is a good sign, especially if you're aiming to treat acne, because that means it's been reviewed for safety and effectiveness for that specific purpose. Checking user reviews is always smart too. The source warns against those super cheap, unbranded gadgets. They might not deliver the right light, or any light, reliably.
And how important is just sticking with it when using these at home?
Oh, consistency is absolutely key. You really have to follow the instructions. The session length, usually 10-20 minutes, and the frequency, often several times per week. Don't expect overnight miracles. It typically takes 4 to 8 weeks of consistent use to really start seeing noticeable changes. And again, more is not better. Don't overdo it thinking it'll speed things up.
And eye protection still mandatory at home, even with a mask?
100%, yes. Even if it's a mask, keep your eyes closed underneath, or better yet, wear the goggles if they're provided. Always protect your eyes.
What about the best time of day to fit this into a routine at home?
A lot of people find morning or daytime use works well. It fits nicely with the potential energy boost and avoids the sleep disruption issue. If evening is the only time you can do it, just make sure it's well before you plan to sleep, like several hours before.
What if no one does everything right? Gets a good device, uses it consistently, protects their eyes, but they just don't see the results they wanted for their acne?
That definitely can happen. Remember, home devices are less powerful than the clinical ones. That's part of why they're safe for home use. But it means they might just not have enough oomph to tackle more stubborn or severe cases. The source mentions that for more significant acne, professional in-office treatments might be necessary to get the desired effect. It's probably wise to chat with a dermatologist before dropping a lot of money on a home device, especially if your acne is more than just mild. They can tell you if blue light is even appropriate for your specific situation and whether a home device is likely to cut it, or if you'd be better off considering clinical options.
Right. So home devices can be great for maintenance or milder stuff. Choose carefully, be safe, eyes, timing, be patient and consistent, use it alongside good skincare, and keep expectations realistic. Professional advice is always valuable.
Hmm.
Okay, to really understand blue light, it helps to compare it to red light therapy because they get talked about together so often and even combined in devices. What are the main differences between blue and red light therapy?
Yeah, great comparison to make. The biggest difference is penetration depth and what they target because of that. Blue light is very shallow. It stays right in the epidermis, that top layer. So it's great for surface issues like bacteria hanging out in pores.
Whereas red light,
Red light goes much deeper down into the dermis. That's where it can interact with things like fibroblasts, the cells that make collagen blood vessels, and deeper inflammatory cells.
so thinking about acne again, blue hits the surface bacteria, while red gets deeper to calm inflammation and help healing.
That's a perfect way to put it. Blue's main trick is that photochemical kill mechanism for bacteria, plus some surface anti-inflammatory effect. Red light works differently through what's called photobiomodulation, basically using light to influence cell behavior. It boosts mitochondrial energy production in cells, encourages collagen synthesis, improves circulation, and has a strong anti-inflammatory effect deeper down. Red light doesn't directly kill acne bacteria like blue does.
Okay, and what about the main benefits people associate with each one?
Blue light is best known for acne, its general antibacterial effect, maybe improving surface oiliness and clarity, plus that separate mood and circadian rhythm angle via the eyes. Red light is really famous for anti-aging, helping with wrinkles, skin texture, elasticity. It's also great for promoting healing of wounds and scars and reducing pain and inflammation more broadly. For acne, red's role is more about calming the inflammation and helping prevent scarring. It's generally good for overall skin health, including sensitive or aging skin.
They sound really complementary then, not really in either situation.
Totally complementary. They tackle different aspects of skin health. For something like acne, using them together either simultaneously in one device or maybe sequentially is often seen as more effective than blue light alone. Blue kills the bugs, red calms the fire and helps repair. You could even use them at different times for different goals, maybe blue in the morning for clarity and energy, red in the evening for skin repair and relaxation.
Any difference in how they affect different skin tones?
Both are generally safe for all skin tones because neither is UV. But as we mentioned, blue light does carry that slightly higher risk of causing temporary post-inflammatory hyperpigmentation, those dark spots, especially in darker skin or people prone to melasma. Red light is much less likely to cause pigment issues and might even help reduce inflammation that contributes to pigmentation. So you might lean towards blue for more oily, bacterial-driven acne, and maybe red or a combo for more inflammatory adult acne or for anti-aging or sensitivity.
The guy had a nice little summary, like blue light is for cleaning and calming the surface, and red light is for healing and restoring the skin.
That nails it, yeah. Each has its unique strengths. Using both, either together or strategically, can offer a much more comprehensive approach depending on what you're trying to achieve.
Okay, so pulling everything together from the guide, who really stands to benefit the most from trying blue light therapy?
Well, based on the strongest evidence, the clearest beneficiaries are people with acne-prone skin. We're talking teens, adults dealing with that mild to moderate inflammatory acne.
And maybe people with generally oily skin too.
Yes, potentially helping with oiliness and just general skin clarity. It's also a really appealing option for anyone who wants to avoid acne medications, maybe due to side effects or during pregnancy or just out of personal preference for a drug-free approach.
And it avoids the antibiotic resistance issue too.
Exactly. That's a big plus. It offers a way to target bacteria without contributing to resistance, making it useful for maintenance or alongside other treatments to maybe reduce medication dependence. The guide also mentioned groups like biohackers or natural wellness folks who might be interested in the drug-free energy or mood aspect, remembering that critical daytime timing, of course.
And then there are those specific medical conditions, but only under supervision.
Right. Things like actinic keratosis, usually as part of PDT with a drug, or mild psoriasis using those specific FDA-cleared devices, maybe certain skin infections or wounds. But again, that really requires a doctor's involvement, not DIY territory.
And like we joked, maybe almost anyone could use a little mood boost from timed light exposure on a gloomy morning.
Potentially, yeah, if done safely through the eyes. But really, the most solid, well-documented benefits circle back to acne and those surface bacterial or inflammatory skin issues. Best advice is always, talk to a dermatologist to see if it actually makes sense for your specific skin concerns.
Wow, this has been incredibly informative, really digging into that guide from redlighttherapy.rehab. Let's just quickly crystallize the main takeaways. The absolute need-to-knows.
Okay, quick summary. Blue light therapy. Specific blue wavelengths, usually LEDs, non-invasive, generally painless.
How it works. Primarily, photochemical action on the skin surface kills acne bacteria via porphyrins, reduces local inflammation. Separately, big impact on circadian rhythm and mood via eye exposure.
The number one use, best evidence FDA cleared for it, acne treatment. Good data showing it reduces breakouts and inflammation in mild to moderate cases. Safe alternative or add-on to meds.
Other potential uses, wound healing, psoriasis, mood support are interesting, seem promising in some studies, but the evidence is generally less strong or more preliminary compared to acne. Needs more research.
Safety. Generally safe when used right. Big advantage. And no UV risk. Minor temporary skin side effects possible. Critical point number 1. Eye protection. Always. Goggles or eyes shut tight.
Critical point number 2, timing. Avoid using it late at night, bad for sleep. Stick to daytime or early evening, hours before bed. And don't overuse more, isn't better, could cause stress. Be cautious with photosensitivity or if prone to pigmentation.
Practically speaking, clinic treatments are more powerful. Home devices offer convenience for maintenance or milder issues, if buying one. Choose reputable brands. Check for specific wavelengths, 400s nanometer. Look for FDA clearance for acne. Be consistent. Use it with your skincare and manage expectations. See a pro if unsure or for stubborn problems.
Yeah, it really comes across as this fascinating, gentle tool that leverages light's interaction with our biology, especially effective for those surface skin issues like acne.
Exactly, a science-backed approach using light.
So let's leave you with this final thought, kind of inspired by digging into this guide. When you think about how something as specific as a wavelength of light can target bacteria on your skin and also influence something as fundamental as your body clock, what does that suggest about the really subtle but powerful connection between light in our environment and our overall health and well-being?
It's profound when you think about it. How could understanding the distinct roles of blue light versus red light maybe lead us to be more mindful, more intentional about the light we expose ourselves to or avoid throughout our day?
Food for thought, definitely.
Yeah.
It kind of reframes light as more than just illumination, but as an active biological signal.
It really does. A huge thank you again to redlighttherapy.rehab for providing the excellent resource that kicked off this whole deep dive.
Absolutely. And
Well-
thanks to all of you for tuning in and exploring this with us.
We'll catch you on the next deep dive.